afternoon, Year 12. Welcome back to the last part of depression in our psychopathology module. So once we have finished this, we have 3 lessons to go on OCD, and then we're ready to move on to looking at some of our Year 13 research method content, which is the trickiest stuff of research methods, and it does take a lot of practice, which is partly annoying that I'm not being able to do it face to face, but I think actually practically it's probably one of the best modules that you can do remotely, okay, depending on what's going to happen in the next couple of weeks. So on to our last bit. How do we go about treating depression? We've looked at characteristics of it emotionally, behaviourally, and cognitively. We have looked at the explanation for it. Why does it take place? Looking at Beck and Ellis's 2 different models with the same sort of principles. And now we have to look at treating it. So what procedures, what therapies are put into place to help manage and I don't think you ever get rid of depression. I think it's something that's treatable and manageable to sort of sustain a level, I would say. So what are those that we need to look at? Quick recap quiz then for your embedding of knowledge. It's a true or false from approaches, from social influence, from research methods, from memory and attachment there. So 5 questions. Pause this, read through them. Anything that you weren't sure of or that you didn't know, try and guide some of your independent revision, independent study time to that area, because like we said, on and on, nothing's changed in terms of the exams as of yet, potentially. So we need to be in there with that mindset of I still need to be knowing everything from the start of Year 12. There's a lot of topics, a lot of modules. So if you have notes there ready to go, it saves you a lot of time in Term 4 in Year 13 when we're finished. So you haven't really got to make anything. It's just going over it and recapping it. So answers to these then: true, false, 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 true. And we're on to this. So how do we treat it? One of the main ways of treatment is cognitive behavioural therapy, which you might have heard of already, which shortened down to CBT. It's our most commonly used psychological treatment. So it's also used for anxiety, panic disorder, phobias, bulimia, OCD, PTSD, because the element or the principle of CBT is that there is a psychological aspect. There is something with your thought processes, irrational thought processes, that we need to rationalise to be able to move forward and treat it in a kind of a normalized way. So it's on the principles of Beck's theory. The method for treating them are based on behavioral and cognitive techniques. So like we've said, those irrational thoughts and the way that we act in certain situations. Therapist and client aim to try and look at the relationship between thought, emotions, and actions. So if we think about the humanistic approach and client-centered therapy, this is developed from that, and it's again having the patient involved in this process, trying to really normalize those situations, but trying to create and make them aware of the relationship between these 3 things. If you have a chance, actually, thinking about humanistic, on, what's it called? there's a BBC podcast page of psychology. If you go onto BBC website and just type it in, there are a load of podcasts that you can listen to on pretty much everything that we go over. So, because I couldn't sleep the other night, I was listening to a podcast on client-centered therapy and how it was created by Carl Rogers, and a bit of Maslow in there. It was really interesting, actually. They've got some really good ones on there, so you can have a little look at those in your independent time. Last bit there, so CBT helps, like we said, change the way people think and what they do, in the aim to help make them feel better and to manage situations effectively, pretty much. So CBT, the main principle is to try and break down a vicious cycle or a vicious circle of maladaptive thinking, which in turn creates maladaptive feelings and maladaptive behavior. Maladaptive just means it's not helpful. It's hindering your life, hindering your progress, kind of like dysfunctional. So it looks at the here and now, what's happening right this minute, looking at problems and difficulties, doesn't really focus a lot on the past. So whereas our psychodynamic, psychoanalytic therapy would be focusing on previous trauma or, the id and the ego and all the rest of it, CBT is focusing on how we can improve the situation of people's lives right now. And it wants to try and develop a bit of a DIY approach so that when they leave the therapy office, they have these tools, they have these techniques to tackle their problems. One of my close friends, her parent, her dad suffers with manic depressive disorder. He's tried to kill himself many times, lots of suicidal thoughts, and after therapy and being sectioned for a little bit, he has kind of this toolkit that he uses to try and deal with certain situations. So whether it be a stressful event at work, they give them breathing techniques. It's things like homework that therapists set for them to go and try and tackle sort of bit by bit how they can deal with certain situations. It takes a lot of time, but CBT has the ability to be really long term and effective. So this little cycle here says what CBT involves. So you're meeting with a therapist, the same therapist, between 5 and 20 weekly or fortnightly sessions, lasting about 30 to 60 minutes. Starts with that main assessment, breaking it down into how they can formulate goals and get an idea of that individual. Then the treatment revolves around a monitoring process, setting of homework that they need to come back and reflect on, and then that treatment is complete. So then they leave with this toolkit, constantly being monitored to make sure that's effective for them, and they have an outcome and what their goal is to achieve. And the only thing with therapy and the problem with it is that it is quite intrusive, and also it means that, or it makes the assumption that people want to be helped. Now, you can't help somebody who doesn't want to help themselves, which is a problem with therapy because it does take a lot of time. Sometimes you have to go on a waiting list, especially for NHS, which could take a while unless you go private. And if you want something here and now, it is something that is, it is a long process, and people don't want to take part in it. They feel it's not going to help them, or there's a negative stigma around it. So that can be quite hindering with CBT. Quite a few of them draw on the techniques of Beck and Ellis. So what's great about those two theories and how they explain depression is that they have formulated and paved the way for CBT. So in terms of backing why it's a good thing that Beck and Ellis have these two models, is that we have a lot of external validity because it has been used, some of the principles, to create this therapy to really get to the heart of depression. So, two types. Beck's cognitive therapy. So Beck wanted to challenge that negative triad, if you remember, the beliefs of the client. So the beliefs of their self, the world, and the future. So it's there to try and delve into those three aspects. They'll be assessed based on the severity of their condition. Then they'll get like a baseline of where they need to start treatment to help monitor improvement. So there's always got to be a baseline assessment. So that, what we looked at earlier, are thoughts, influence, emotions, and behaviour. To feel better, you must think positively. And there's something that says if you smile, you instantly feel better. That's why people always advocate smiling at strangers, because it releases endorphins that make you happy. It's the same here. So if you want to feel better, you've got to think positively. You can't have this debilitating mindset. I can think of an example of a self-fulfilling prophecy from my life. One of my first days on my PGCE, So I had to drive to Southampton to go and just meet the course reps and the rest of it. And was a very nervous drive. I'm a little bit better now. It was in my car on my own for an hour and a half to Southampton. And I had it in my head, I'm going to crash. I'm just going to crash because I just, I'm not that confident. I'm on my own. I'm definitely going to crash. What happened? Well, I obviously crashed. So you talk yourself into something happening. It's like a massive self-fulfilling prophecy. So that was fun. But same here. If you want to feel better, if you want to have a good outlook, you've got to think as positively as possible. Especially in, where we are right now in this pandemic, it's so easy to spiral out of control with negative thoughts. I'm never going to see anyone. It's never going to be the same. But ultimately, this will end. We will go back to school. You will go back to school. It will look different, but it will still be school. It will still be what you remember it to be. So you've got to think positively, have a good outlook. The client's asked to provide information about how they perceive themselves, the future and the world, so what it looks like to them. Usually it's this absolutist thinking, isn't it? It's all black and white and negative. Then use a process of reality testing. And they do this with schizophrenia, which we'll look at in year 13. To say, when people say, I'm useless, I always fail, they'll be asked whether in reality they have been successful at something. So we see this in school all the time. Kids are like, I can't do this, I'm rubbish at maths. And the therapist will, ask them to provide evidence where actually they are, or they have done really well on a test. Or they'll, ring teachers and be like, how are they actually? So a bit of reality testing to check that what they're saying is true or not. And 9 times out of 10, it's just that irrational thought process that makes it more negative than it is. And we all have that. Ask them to demonstrate, like I just said, the ability to succeed. So they say they're rubbish at something, they'll get them to do it, and then they'll assess whether or not they think they are poor at it or whatever. So the client's beliefs are directly challenged. So they're made aware of their negative views, trying to promote it and trying to change it to something more rational and optimistic. And that takes time to try and really rewire somebody's thought process. It's not something that happens overnight. So Ellis also has a method of CBT. On page 150, go away and make notes on it. How is it similar or different to Beck? So pause this now and go and do that. And then we'll talk about it here. So Ellis's rational emotive behavioural therapy, or REBT, as it's called, extends his previous model of the ABC. So that activating event, the belief, and the consequence. The DE is the disputations to challenge those beliefs, and effective new ones replace the irrational beliefs. Okay, so dispute and effect are the extensions of his ABC. So kind of similarly to Beck, it is challenging those irrational thoughts to try and make them more understandable, more reasonable, more testable, really. So Ellis is arguing that the main cause of all types of distress are irrational thoughts. We've got a common theme here. It's coming up all the time. It's based on the premise that whenever we get upset, it's not the events taking place that upset us, it's the beliefs that we hold that can cause us to become depressed, anxious, enraged. And those irrational beliefs, that's a common theme, makes it impossible to the individual, or it creates these impossible demands to try and it creates demands on individuals which lead to a failure, which lead to psychological difficulty. And most of them, 9 times out of 10, it is those irrational demands are being put on ourselves. I need to do this, I can't do this, I'm such a bad person. It makes us feel anxious and upset. And then it challenges them to prove these statements, so with more realistic views. So they are very similar, the two. But are they effective? So it is effective in reducing symptoms. It is the main psychological treatment for a lot of mental disorders. And it's a good way of preventing relapse because you are providing them with a toolkit. It's the most effective for moderate depression, and it's as effective or better for many types of depression compared to antidepressants. So one of the main, they usually start you off actually, if you go to the doctors and say, I'm having these thoughts, the first thing they will do is put you on antidepressants, which I'm surprised they do that because that is actually more of a negative, I think. So you put them on antidepressants to try and tackle the imbalance of the neurotransmitter and the hormones. From there, they will then provide CBT. So actually, a combination of the two is the most effective way of treating depression. Doesn't work for all cases. If it's really severe, manic depressives, then it is quite difficult to try and engage them in therapy. Like I said, it takes time out of your life to go to therapy. It's very intrusive. If you can't get through the NHS, because it takes months and months and months, it can be quite expensive. So it's not the sole treatment in all cases. So we can't say that it is highly ecologically valid, because it's only some cases that maybe it's more effective. Then quite a lot of the time, and you can see why, I think it's the same in schools actually, that success is potentially due to the relationship between therapist and patient. In school, we all have a favourite teacher that we want to work hard for, or that, are really encouraging. And I think here with therapist and patient, it's the same. So there's actually little difference between CBT and other forms of psychotherapy. It's due to the quality of that relationship, whether they feel that they can trust them, to divulge lots of information about themselves and their lives. So that, I think, makes it more successful than the treatment itself. So that's quite an interesting one, actually. Then, like we said, CBT and drug treatment, when they're used together, Keller found 85% recover from depression than just drugs alone or CBT alone. So it has to be a combination, because depression is a disorder that is neurological. So, it has a neurotransmitter element, has a hormonal element, but it's also cognitive and psychological. There is a reason that they're feeling this way, and they have to be combined together. You can't get to the cause of someone's depression through a pill. It has to be, divulging some of that information and talking to somebody. Then what CBT potentially doesn't do that other therapies may be better at is get the patient to explore their past. Some people might want to talk about childhood. They might want to talk about various trauma, but CBT focuses on here and now. So this present focus approach can be quite frustrating. There's an overemphasis on cognition and irrational thoughts. So there's a risk that if you're focusing on what's happening in the mind, you could minimize the circumstance or the context in which they're living. So you've got a bit of an ethical issue for cognitive behavioural therapists, because they've got to keep in mind that not every problem that people have is in the mind. Some of them are context-based. So that's a problem that CBT faces. Then finally, I don't think I've set this as homework, but you might want to look at planning this or writing it. Describe and evaluate CBT as a treatment for depression. So all your AO1, bring in Ellis and Beck's 2 different types of CBT, and then your evaluation.